Everybody, good morning and welcome once again to a weekly media briefing and public health update with Montgomery County Executive Mark Elridge. I'm Laura Vigili, Hispanic Public Information Officer, and joining us today is Dr. James Bridgers, Acting Health Officer, as well as Dr. Earl Stoddard, Assistant Chief Administrative Officer, Mr. Sean O'Donnell, Program Administrator, Public Health Emergency Preparedness and Response for the Department of Health and Human Services, and Ms. Kimberly Townsend, Senior Administrator for Communicable Disease and Epidemiology for the Department of Health and Human Services. Joining us today as well is Ms. Jessie Mejia Terry, who is the county's Latino liaison with the Office of Community Partnerships. Members of the media, remember to use the chat when we enter the Q&A portion of this presentation to request your turn to ask questions, and remember to identify yourselves, the organization you represent. And with that, Mr. County Executive, I toss it to you. Good morning. How are you today?
I'm fine. I will warn you that if my battery actually runs out on this computer, I may experience a brief delay as we switch over to device number 2. But let me not waste any more time talking about that stuff that's not there. So let's start. So today I'm talking to you from the Metropolitan Washington Council of Governments, and I'm down here for the Board of Directors meeting starting at noon. I want to thank the Council of Governments for providing the space and for everything else they do for the region, which is much bigger than providing me this space. COG is really critical to organizing our region's efforts on transportation, housing, the environment, as well as equity efforts. I want to note that over the summer, COG Executive Director Chuck Bean announced that he will be stepping down at the beginning of the year. And I want to thank Chuck for his service for nearly a decade here at COG. He's provided, real leadership and stewardship, and I'm glad he's going to be still here to help with the transition of leadership. He was here when I was on the council, so I got to work with him for many years. I want to start today by talking about Thrive 2050 and the very troubling update on the county's Thrive Master Plan that they received yesterday. Thrive 2050 is the county's master planning document that will impact all of our general plans moving forward for the next 3 decades. I got to hold on a second. Scott, whatever they did took over my entire screen. There. Okay, let's try this again. So the Thrive 2050 is the county's master planning document that's going to impact all of our future general plans moving forward for the next 3 decades. While it doesn't directly do the zoning itself, that part of what was originally intended, the council separated out from this. So you're not seeing the planned zoning as well as this document at the same time. There is planned zoning that goes along with this document. And that's probably the thing that has the greatest concern. But this document sets the stage for how the zoning would be applied. This is a very big deal for the future of the county, given all the things that it's going to affect. It's going to influence budget expenditures. Our staff informed the council that the infrastructure to support this plan was billions of dollars. It was dismissed by some council members who just said, I simply don't believe it. It's going to impact the educational system. It impacts transportation infrastructure, economic development, environment, and it creates and how we go about creating more affordable housing, as well as our racial equity and social justice efforts. I'm glad the council decided to commission a racial equity and social justice review of Thrive. That was not done by the planning board originally. This review was conducted quickly because of time constraints. It was intended to solidify the plan moving forward, but it actually did the opposite. We now have more questions than answers. This week, I sent a letter to the county council encouraging them not to move Thrive forward until concerns regarding the lack of equity and community involvement are resolved, and until the fundamental issues underneath all that are resolved. We're going to put a link in our chat to that letter in our chat. And I also want to encourage everyone to watch the consultant's report to the council yesterday if you haven't seen it yet. But this is what they said. First, they said, generally, we found a lukewarm reaction to Thrive's policy amongst our target demographic. and this was largely the minority community in the county. While we received some positive feedback, many people expressed frustration due to a lack of perceived context sensitivity in the approach that did not go far enough to consider and prioritize the needs of working class communities. Some folks expressed skepticism around the successful implementation and felt that adverse unintended consequences are likely on their communities if certain safeguards are not reinforced in the methodology. Additionally, there were many who felt that the prior community engagement efforts were not adequate and the plan did not reflect the true participatory process. I'll point out, I said those about this plan from the beginning. Three main issues were identified as being the primary problems with past outreach: a lack of demographic data gathering, lack of racial representation in early phases of engagement, and lack of transparency and clarity about the stakeholder and community outreach process. In general, the report said, for all plan chapters, the how we will evaluate progress sections need to include establishing specific targets for equity outcomes. For example, establish a criteria to support Black-owned businesses, recruitment, and retention. After revising Thrive, in other words, they think it needs to be revised, revisit with low-income and BIPOC communities to make sure communities can support the policies before passing the document. Allow more time and resources to complete drafting RESSJ's review language, which is our Racial Equity and Social Justice Committee. Conduct a housing study that will seek to address displacement fears by community, determine how to achieve growth targets and identify barriers to successful implementation, and establish working relationships with communities that prioritize participatory planning and delegate power to vulnerable communities. The feedback gathered by the consultant team and the significant changes they recommend is why I've urged the council disapprove Thrive 2050 plan. Now, the council does not have time to revise Thrive and address all these concerns before the statutory deadline, which is October 25th. It simply cannot be done in that time. When summer began, we had a goal of getting back the time the pandemic had taken away from us through intense outreach on Thrive. Instead of reaffirming the work, the effort has only scratched the surface on issues that we need more information about. And the previous housing element, which is only 10 years old, had more concrete solutions in it to affordable housing than this document has. This document's not even close to what the other document provided as guidance for affordable housing. We need to get this right, and we still want to give our community the best roadmap moving forward. It just may take more time to draw up that map. There is absolutely no urgency to this. It has been presented as this needs to be done in order to provide affordable housing or more housing. The county has over 30,000 units already in the pipeline that all a person has to do is pull a building permit. So it's not like this is necessary in order to make sure there are houses or buildings to build. We already have achieved that. We just need people to build it. Move on to Hispanic Heritage Month. Hispanic Heritage Month begins tomorrow on September 15th, wraps up on October 15th. Over that time, there's lots to celebrate. Soon you'll see our county's Hispanic Heritage Month calendar, where you'll find cultural celebrations and other county community programming open for everybody to enjoy. More than 200,000, you guys have done this again. I don't know why this happens. More than 200,000 Latinos called Montgomery County home, and 30% growth. It's had 30% growth compared to the last federal data collected in 2020. So it's been the fastest growing population here. The previous census report showed us that Latino children made up a higher percentage of the school population. Today, close to 1 in 3 MCPS students are Latinos. In our county, you'll find schools that have expanded programs to help students coming in from all over the world. We now have 6 schools that offer two-way language immersion classes to help Spanish-speaking children at the elementary school level. Efforts like that have helped MCPS raise its graduation rate for limited English students by nearly 10% over the last 5 years. Montgomery College is also a resource for Latinos through the Hispanic Business and Training Institute, It offers classes in business, entrepreneurship, professional development, and licensure. And these classes are either taught in Spanish or are bilingual. And here at the county, we've also begun to make our procurement process more accessible to Hispanic-owned businesses. This summer, we held a 3-part workshop on obtaining county contracts entirely in Spanish. Montgomery County Spanish language health campaign, led by the Latino Health Initiative, used the Emmy Award-winning character La Abuelina to help encourage the community to take COVID seriously and get vaccinated. Those efforts saved lives, led to one of the highest rates of vaccination among the Latino community nationwide, and is generally hailed as a big success. La Abuelina and her family reflect our county's commitment to ensuring that we're messaging in culturally competent ways that actually make a difference. And as a government, we're evolving beyond just providing Spanish information in Spanish, but connecting directly with these communities, with government employees, and with community partners who are part of their communities. And I'm glad we have this opportunity to celebrate and spotlight and honor Hispanic Heritage Month. And at this point, I'd like to welcome Jessie Mejia Terry, a community outreach manager and the Latino liaison from Montgomery County, to discuss what we can expect this month.
Good morning. Thank you, Mr. County Executive. Jessie Mejia Terry, Latino Community Liaison. Wanted to go over some of the Hispanic Heritage Month county programming. This year, it is a robust mix of cultural, artistic, educational, and fun programming that marks a month of heritage commemorations and celebrations in Montgomery County. Libraries across the county will be hosting story times and other fun activities for readers of all ages. Our plazas and parks will be hosting cultural and artistic events, free and open to the public. Montgomery College will feature diverse and wide-ranging educational and social gatherings for more in-depth historical and literature discussions. The county has produced a Hispanic Heritage Month 2022 calendar. It features the now renowned Abuelina and her family, who's been helping us reach Latino families across the county over the past 2 years with health information. I am going to share the screen now just to show a little bit of the calendar and its look. You will see this posted on platforms and shared widely beginning tomorrow. And Abuelina and her family. And you will see that the calendar will be divided by regions. So activities going on in Mid-County, Silver Spring, Up County, Bethesda, Rockville, and including a section for Montgomery College and the programming that they have set up for this month. So you will see this, we will be sharing this very widely. And so you'll be seeing it for the rest of the month. I will stop sharing at this point. And the calendar will be available in English and Spanish. You will see the programming, like I mentioned, by county region, including highlighting Montgomery College's events for their different campuses. Regarding the county executive's highlights for the Heritage Month, the county executive will be highlighting the Heritage Month through a series of business and economic development spotlights on the growing Latino small business community, addressing the community through the county's Spanish language radio show Montgomery al Dia, and concluding the Heritage Month joining a cultural celebration at the Marion Fryer Wheaton Town Plaza on October 15th. During the month, the county executive will be visiting with several Latino-owned businesses across the county to highlight the contributions of this sector to the local economy and learn more about the growth opportunities that can be generated through his administration. 4 tour visits beginning this Friday, September 16th, and continuing on September 23rd, September 27th, and October 7th will highlight the several businesses across the different regions. The executive will also be hosting Latino entrepreneurs on October 14th to continue the dialogue begun in June with that 3-part workshop that was held entirely in Spanish to facilitate and enhance the county's procurement process for all growing small businesses. Regarding his visit at Montgomery al Dia, the radio show, On Tuesday, September 27th at 2 p.m., the county executive will be a special guest at the county Spanish language radio show with its guest host, Lorna Virgili, here today, focusing on his business and economic development agenda spotlights for the Heritage Month. He'll be promoting the different county programming offered through the Heritage Month for the public and inviting everyone to join him for the closing community cultural event on Saturday, October 15th. This cultural community celebration on the 15th will be taking place also at the Marion Friartown Wheaton Town Plaza. It'll be the concluding event of a 4-part series called Dance for Life, Latin American Culture Through Music. Dance for Life will be a family-oriented series of events focused on diverse cultures, rhythms, and dances of Latin America and the Caribbean. Beginning Saturday, September 24th, the series will be every consecutive Saturday after that. So September 24th, Saturday, October 1st, October 8th, and concluding on October 15th. These will all be 5 p.m. to 8 p.m. All events will include live music, free dance lessons, and dance competition featuring some of our county's high school competitors. We will be extending the invitation to everyone. And that is the report on the county's Hispanic Heritage Month celebrations.
Thank you, Ms. Mejia Terry. Mr. County Executive, Public Health Update.
Thank you. And thank you, Jesse, for the report, and look forward to seeing a lot of you this month as we go around the county doing these activities. I want to talk next about our very successful opening yesterday of an affordable housing project in the city of Rockville. We had the opportunity to celebrate the reopening of an apartment complex in Rockville that highlights what we can do as a county in working with our partners to help protect tenants from displacement while protecting, preserving, and producing dedicated affordable housing. Parkside Landing is a beautiful and affordable rental community near Dogwood Park in Rockville. It's walking distance from the downtown area and close to the metro station. This complex could have been the latest older community turned into market rate apartments with sky-high rents. To put this in context, in the year 2000, this county had 45,000 naturally occurring affordable housing units. By 2020, that number is down to about 22,000, and Park and Planning is projecting by 2030 we'll lose another 11,000. So we're on a trajectory to see existing affordable housing evaporate, and this is a great example of our ability to step in and prevent at least one chunk of it from going away. We worked with property owners. We worked with the city of Rockville and the Rockville Housing Group, which does amazing work and is very committed to preservation. And instead of losing this, we provided about a little over $5 million for the project, along with other funders, the city of Rockville, Maryland Department of Housing and Community Development, and even HUD. Rockville Housing Enterprises used the financing package to preserve 118 affordable units and produce 59 additional affordable units. And with this project, we protected the affordable housing already in place and also created new affordable units for renters in a location that suits many of their needs and is actually ideally located, being not only close to parks, but close to public transportation and services. This fiscal year, we've put $140 million earmarked for affordable housing, the most we've ever done. 100 million of that's going to be used for capital lending. This is 2.5 times the amount spent in previous budgets. 2.5 times the amount spent in previous budgets. So I want to make sure everybody understands that. $100 million of county financing can produce or preserve up to 2,000 dedicated affordable housing units. We've already dedicated at least 40 million of that capital lending to preserve the affordability of up to 700 units facing increasing rent pressures like properties near transit and the forthcoming Purple Line. Failing to focus on affordable housing is going to lead to loss of our workforce. Years ago, it was teachers, firefighters, and public services that needed this protection. Now more than ever, it's everyday folks who fall into the category of not making enough money to keep up with the soaring home and rent prices. I know some of you are going to say, well, county executive, what about Montgomery County's moderately priced dwelling unit program? That program is, 50 years old. I hate to point out, but there's a mere 6,700 affordable rental units left out of a 50-year-old program, because everything built before 2005 had limited expiration dates, so either 10 or 20 years. So the last of the units that were built in 2005 will expire and go back to the market in 2025. So the existing program doesn't work. When that program was created, this phrase, teachers, firefighters, and police officers, was seen as the people in the county workforce who needed help with affordable housing. This is a very different county than it was. And around 1970, the census shows that Montgomery County was about 95% white and 5% everybody else. And income skewed much more toward the middle. And the changing nature of work in the county, the changing people who've moved into the county for the jobs, particularly the lower wage retail jobs that came to be very dominant, do not make the money that was originally envisioned when we set up this program, the MPDU program. So they fall below the income levels that program serves. That program also doesn't serve people who make a little bit above the cap, which would be around $75,000 or $80,000. It doesn't serve them, and yet folks making $85,000 could not find an affordable apartment in Bethesda to rent in the new buildings that have been built. So we really need to think about who we serve and how our programs haven't changed over time to match the changing demographic. And failing to deal with this is really going to have serious consequences. One of them is the loss of a workforce who can't afford to live here. Over the next several months, you're going to hear more updates about the progress we're making to produce, preserving, and protecting affordable housing. I look forward to the continued updates as we move forward with the development of affordable housing on 18 separate county-owned properties throughout the county. We're putting those out in 2 tranches of 9 with actual RFPs. We did REOIs to get expressions of interest. We had over 130 expressions of interest. Now we're packaging these up, and we'll start moving them to the market. At the beginning of this month, the Department of General Services issued a series of requests for developer proposals on these sites in Bethesda, Silver Spring, Glenmont, Rockville, and Wheaton to ensure that we're using every tool at our disposal to build more affordable housing units. Now for the COVID update. As far as COVID goes, this week our community levels remain low. Case rates continue to decline, and our hospitalizations from COVID have decreased by about 25% over the last month. I continue to encourage everyone to get vaccinated and keep up to date with the booster shots. The newly authorized vaccine boosters are designed to protect against the Omicron strain. It's meant for anyone 12 and up who hasn't had a booster within the last 2 months. And vaccines are available through the county, but actually there are many more vaccines available through private providers, through local doctors and pharmacies. So the county, in this case, is not the sole source or even the major source. So you have many more places to go than just county clinics to get these vaccines. Again, it's important to point out that with this new vaccine, which deals with the original variant, the original coronavirus and all its variants, including Omicron, we are no longer giving out, we're not supposed to give out, and we're not giving out any of the other boosters. And so the only booster you can get now is the booster that's protects both against the older strains, but also against the new Omicron strains. So it's a little change, and you might, if you think you're going in and asking for just a regular booster, this is the booster you'll be getting. The new booster is critical to ensuring that we don't have another winter like last year. And it's imperative that folks get their shots over the coming weeks before the weather gets cold. Everyone is inside more often, and the virus becomes more transmissible. Again, the virus continues to mutate. We don't know what the next special edition is, but this gives us an opportunity to be better prepared. We do know how to beat COVID, and it's clearly the vaccines. There's still a myth that out there that getting a vaccine doesn't matter because you can get sick anyway. That is way oversimplifying what the difference is. It's what the data shows. And there's a story, yesterday that if one gets COVID and they're unvaccinated, their likelihood of winding up in a hospital is 10 times that of a vaccinated person. Also, an unvaccinated person, the average age was, I think, in the 50s, whereas the average age for somebody who was vaccinated was in the 70s. And that's because people in their 70s are increasingly vulnerable from other health issues, which makes, COVID just one more thing that many people are dealing with that puts their health at greater risk. So there are real reasons to get vaccinated, and they appear, you can find the data, we keep putting it out. This makes a difference and it will save lives. And that's probably been the most important part of the mission we've been on through these 2.5 long years, is making sure that COVID does as little damage in our community as possible. We can't turn our back on the virus, and every time we do, it reappears anyway. So keep that in mind. I'm going to turn this over now to our health experts, Sean O'Donnell and Kimberly Townsend, for our COVID and our monkeypox updates for this week.
Thank you very much, Mr. County Executive. So we'll move rather quickly through this. I know many of you have, the county executive has covered much of this, and you may have heard this from previous weeks. Just reminding folks that the new bivalent boosters are available at a number of pharmacies, urgent care centers, other clinics throughout the county. The vaccines.gov will give you information over multiple states, and the coronavirus.maryland.gov will give you a search engine. You can search for specific vaccines through this, and we'll show you what's available locally. You can see these are all spots with the bivalent booster. And this is the search engine from vaccines.gov. Just a reminder that we're monitoring the variant proportions, and we're still within the BA4, 0.6 and BA5 are making up the majority of our cases, even though the case rates have been declining. As you can see, again, the hospitalizations have come down. And when we look at both the acute care center and our other hospitals, they have hovered in the 80 to 90 patients with COVID range, which is, again, much lower than where we were about a month ago. We are continuing to track deaths, and within the county, we've seen a fairly similar number of mortality linked to COVID over the last few months. We are hoping that this may decline a bit following the reduction in transmissions this month, but we are tracking on these. To put those numbers that the county executive shared, put them out in front of you. This is and the link to more information. This is the CDC's publication in JAMA, where they did look at more than 250 hospitals, and they found that not only are unvaccinated adults 10.5 times more likely to be hospitalized than those with boosters, but even those with only their primary series are 2.5 times more likely to be hospitalized than those with boosters, which is why, again, we're emphasizing the boosters. At this point, I'd like to invite my colleague, Ms. Kimberly Townsend, to talk a little bit about the MPOX cases nationally and in our county.
Thank you, Sean. Not too much new information to add. As you can see, we have, as of the 12th of September, 571 cases of MPX in the state of Maryland. And this is a snapshot of the trending of MPX cases nationwide reported to the CDC. Our hope is with mitigation strategies that they will continue to trend downward. There are currently 73 cases of MPX identified in Montgomery County as of September 13th. Here is some demographic breakdown or information about communities and genders that it affects. You can see here the communities that are affected here are Black, African American, and Hispanic or Latino. We have vaccinated 1,594 county residents, and this includes first and second doses. Residents may have received vaccination here in our county or in other jurisdictions. Please note that 27% of the vaccines that Maryland has received are from Montgomery County Department of Health and Human Services. We also have some demographics here from Montgomery County DHHS related to gender and other areas. And again, you'll see the communities affected here that have come in for vaccination are Hispanic or Latino and white non-Hispanic populations. So just a quick pre-registration update. We have 1,000 new appointments for this week. All people on the pre-registration list that are currently eligible for Jynneos vaccine for MPX have been sent an invitation for an appointment. Maryland Department of Health has a pre-registration website as well, and we are communicating with them to ensure that we are able to serve everyone that's eligible for a vaccine as soon as possible. And finally, for those that come in for MPX vaccination at the Dennis Avenue Health Center are being provided with wraparound services such as COVID booster information and sexual health screenings. And finally, we did hold the second town hall in our series of town halls related to MPX on Monday evening, which generated wonderful information sharing and discussion. Thank you.
Thank you very much. Dr. Stoddard, Dr. Bridgers, do you have remarks? No, we can open it for Q&A. All right, let's get started. Hello, Kate Ryan, WTOP, you're first. Good afternoon.
Good afternoon. We're still morning though, so I'll go with that.
Yeah, still morning.
Real quick question on health officer for the county executive. I think it was Dr. Kroll yesterday made mention of it during the county council meeting, that we're weeks away from an interview. How soon before we might have that filled? And a quick question on schools and gun presentations. The superintendent mentioned that she will be holding a series of meetings at schools on gun violence. Will you be attending any of those?
I haven't talked to Dr. McKnight about, when she's going to be doing meetings in schools, but I'm more than happy to accompany her if she wishes that. This is, the school system, so we try not to tread into things, their territory on things, but I do, I'm perfectly open to, joining her because I think this is really important and something we need kids to take seriously. As far as the health officer goes, I'm interviewing somebody in short order, like really soon. And depending how the interview goes and if we make an offer and if the person is interested in taking it, and we assume they're interested because they're getting interviewed, this could come to an end sooner than later.
Thank you.
Thank you, Kate. Members of the media, please use the chat to place a request to ask questions. As of now, I do not see any more members of the media requesting to ask questions. I'll wait a second or two. Any questions for the officials, members of the media?
Could I ask a follow-up then?
Go ahead, Kate.
Sure.
On the health officer, the expected salary would be is it the $250,000 range?
I don't know the number. Dr. Stoddard, do you remember what the number was for that?
So, Kate, it'll vary depending on the qualifications of the individual. It could go as high as 250. That has been historically something where the medical doctors who have the joint appointment. But as a reminder, and this is something we talked about with the county council in May, I believe, We've modified the position description in a way that depending on the individual and whether they would be asked to serve both as the health officer and the chief of public health services or not, that salary range could vary a bit. We increased the flexibility to give us a greater pool of applicants, recognizing that while we'd like to have a medical doctor, we also recognize that, for example, Dr. Bridges has done a great job as acting and could, serve in part of that role as well. So I think we're looking at options, and the salary would be requisite with the responsibilities and experience of the individual involved.
Got it. And this is open to anyone. The monkeypox town hall. What were the most of the concerns that you heard? What were there common thread questions, concerns among people who participated?
Dr. Bridges, would you like to take that one since
sure,
you were
sure.
participating, even though it was in Spanish language? You knew what was going on.
So absolutely. Thank you for that question. Kate and Jesse was participated in the town hall as well, providing translation and responding to Q&A. But for all the monkeypox, MPX, or now the naming convention may change to MPOX, as Mr. O'Donnell indicated, to reduce stigma. A lot of questions are and continue to be about access, what to do if I've been a close contact, how can I get vaccines? We have numbers, we have our communicable disease number to assist with not only the pre-vaccination survey, but also questions regarding access. What if I don't have health insurance? And so we have a system in place regarding those who are insured and uninsured, because we want to make sure that all are vaccinated and we have a fair and equitable access. A lot of questions about what should I do when I travel, or if I travel, close contact, if I touch, if I touch doorknobs, et cetera. So some of the public health messages that we continue to feel are central to that. Jesse, if you want to add to anything else that I've said, but I think that pretty much covers it. A lot of questions. We will be having follow-up town halls with as Ms. Townsend indicated in her update regarding the data and the data points and the concerns in both racial and ethnic communities. We want to make sure that the messaging is targeted for greater outreach and access by those communities where we see higher case counts. Our case count numbers are different for our Latinx population versus what the state is tracking for higher case counts for our African-American community. And then we want to have a general conversation with the public. Education and outreach, as Ms. Townsend indicated, regarding sexual health is part of that communication in these town halls that we are hosting. Also wraparound services, other services that we provide within the Department of Health and Human Services. So those were many of the questions and continue to be many of the questions as we move forward in our MPX Town Hall series.
Thank you very much. Can I circle back for one last question to the county exec?
Go ahead, Kate.
Thank you. I did want to ask you, Mr. Elrich, do you feel that the, and this is switching back to the presentations that are going to be made to schools about gun violence and the impact of it, and students have seen that at Magruder, for example, most grievously. Are you, do you have confidence that these presentations themselves can really help make a difference in reaching young people about how dangerous firearms can be?
I'm not sure that's how I'd look at the question, because I think they know how dangerous they are, because they're obviously, those who've used them intend to do great harm. So that's a problem. I think we just have not talked about enough. I mean, it's one thing for talking heads, in the news, or somebody to write a story about how horrible it is, but I don't think that, we've done enough communicating with children about like where this all leads. I don't think we understand fully why children are making choices to go down that path when, you and I would think it's pretty clear what the consequences are of traveling in that direction, but it's not, I don't think it's clear that either people understand the consequences or they feel that they have choices that they could make that would be any better. And, there's lots of stuff being written about this, and what is going on. And I think any opportunity we have to sit down and have a serious discussion is a good one. And, you know, I guarantee you it will not just be limited to guns, because you've got to understand what makes a person feel like they want to pick up the gun. It's not like the gun's sitting there and automatically gets used. Person has to get in the state of mind where they think this is what they want to use the gun. And those are the discussions I think are the most important part of any discussion, is trying to unpack how things have gotten to the point they are and what people are thinking about when they make a decision like that.
Got it. Thank you very much.
I actually would like to add a little bit to that. So the county executive is reimagining student safety and wellness task force has been working on things that go beyond just thinking about gun violence. You think about restorative justice. What one of the core lessons of restorative justice that MCPS has embraced is this alternate dispute resolution. You know, what we're seeing in our communities is that young people, because of the increased access they have to firearms, are often resorting to firearms to solve problems. We see that not just in our school environments, we see that in our communities, and we've invested a significant amount of resources, you know, up till this point and increasingly over the summer in our Summer of Peace activities aimed at addressing the mental and behavioral health issues that we see in our schools, in our community with young people. That investment expands too, and we appreciate the support that the county council has provided on the school wellness programs and aimed at increasing social workers and mental health there. But obviously, this is an issue nationwide that we continue to have to address, given the proliferation of firearms, the inappropriate proliferation of firearms, I might say. And you know, it's just there's a nexus point where students and young people have to have an alternate way of solving their disputes with one another besides resorting to firearms.
Thank you very much.
Thank you, Kate. I do not see any more requests for questions from members of the media. Going once, going twice. I guess that's it for today. Thank you, everybody, for joining us. Thank you to the participants, and thank you for watching. We'll see you next week. Have a great afternoon, everyone. Stay safe.
Thank you.